Hi everyone, thanks for watching today's video. Today I'm going to talk about a condition called pancreatic exocrine insufficiency. To understand what this means, it's very important to understand the functions of the pancreas. And if you watch my video in the link below, you will understand the functions of the pancreas. However, before I start this video, I'm quickly going to summarize the functions of the pancreas. Pancreas has two functions, endocrine function and a second function called exocrine function. These are the two main functions of the pancreas. Today, our topic is based on exocrine function when it is not working normally. That's why it's called insufficiency, pancreatic exocrine insufficiency. Endocrine function is done by hormones and exocrine function is performed by enzymes. What is the difference between hormones and enzymes? These are the substances which are produced by the pancreas and also other organs in our body. But from the pancreas, they are produced in very small amounts, but they do a massive job. They do a huge job. Hormones are pumped directly from the pancreas into our bloodstream, into our blood vessels. Whereas enzymes are pumped by the pancreas into our small intestine. What do hormones do? Hormones are the two main hormones, insulin and glucagon. And all of you have heard of the hormone called insulin because it controls our blood sugar or blood glucose. If we don't have enough insulin or our insulin is not working normally, then we become diabetic. The enzyme that is produced by our pancreas gland into our small intestine, what does it do? It breaks down our food into very small particles. So the carbohydrates, the fats, and the proteins that we eat are big chunks of food. And they need to move from our intestine into our blood vessels, into our bloodstream, where it can go to different parts of our body. So pancreas helps us absorb carbohydrates, helps us absorb proteins and fats, and also certain vitamins, especially vitamin A, vitamin D, vitamin E, and vitamin K. And if the pancreas exocrine function is not working normally, we will become deficient. Our body will not have enough of these substances. So I've drawn the diagram of the pancreas. This green structure here, which looks like a leaf, is the pancreas. There is a little tube in the middle of it. It's called the pancreatic duct. That's the stomach. And that is the first part of our small intestine shaped like a C, in which the pancreas sits in the middle of the C. This is called the duodenum. So when the food comes in, whatever it contains, fats, carbohydrates, proteins, vitamins, it comes from our mouth into our stomach, goes into our small intestine. Pancreas gets stimulated, is stimulated to produce all its enzymes. They go into this tube and they pass into the small intestine where it mixes up with the food and breaks down the carbohydrates, fats, proteins, and everything else that goes with it into smaller particles, so it can move from the small intestine, those particles, into our blood vessels, which are lying outside, to take it to a different part of our body. So what happens in exocrine insufficiency of the pancreas, and how can that happen? So if you can see, I've drawn these black lines crisscross into the substance of the pancreas. So this part of the pancreas, for whatever reason, whether it might be infection, it might be inflammation, it might be tumor, it might be cancer, it might be surgery, that this part of the pancreas has been either removed or destroyed. So it's not producing enough enzymes to go into our pancreatic duct, the tube in the middle, to go and break down our food. The second reason might be that because of, again, infection, inflammation, tumor, surgery, whatever reason, the tube in the middle of the pancreas is blocked. So you can see I've drawn lines in there which is blocked. And although the enzymes are produced, but they can't go through into our small intestine. And when that happens, the food that comes into our small intestine that we eat will not have enough pancreatic juice to break it down. And if it can't be broken down, then we will not be able to absorb that food completely. And that extra amount of fat, proteins, and carbohydrates will stay in our intestine without getting absorbed. So what problems do patients get if they have pancreatic exocrine insufficiency? Because the food is not being absorbed, so the carbohydrates, fats, proteins are staying in the intestine, they get very bloated. So tummy become like a drum. They feel like they are pregnant after eating. They get very gripey abdominal pains. They get very windy, and the wind, whether they burp it or they pass from down below, is very smelly. And they get very slimy, sticky yellow stools, which are very difficult to flush. They float on top of the toilet and they cannot be flushed easily. So instead of requiring one flush, they might need 2 or 3 flushes to clear it. And if the disease is not controlled properly, effectively, then they start getting all the problems with malnutrition. So start getting very weak, weight loss, hair loss, brittle bones. If they are young children, then they won't grow properly, etc., etc. So all sorts of problems they can get because of malnutrition, because all the nutrition that is required by human body to grow, to function normally, is not being absorbed properly. So how is it diagnosed? The diagnosis of pancreatic exocrine insufficiency is not always straightforward. However, if there is a history of pancreatic disease in the past, like patient had inflammation or surgery of the pancreas or any other surgery like weight loss surgery like gastric bypass, blood tests showing very low levels of vitamin A or vitamin D or vitamin E or vitamin K, or also showing very low levels of proteins in the blood. Also, special stool tests like fecal elastase levels, they might not be normal, and the doctors might be able to make a diagnosis on all those things put together. So what is the treatment for pancreatic exocrine insufficiency? The enzymes which are not being produced by the pancreas are replaced in the form of tablets or capsules or powder. Every time patient eats a meal, say if they have an afternoon meal, they'll have tablets with it at the same time. If they're having a glass of milk, they'll have tablets at the same time. If they're having an evening meal, then they'll have tablets at that time. Depending on how much fat, etc. they have in the food, they will either increase the dose of the tablets or reduce the dose of the tablets. Because it has to be taken lifelong for the rest of the patient's life, the dose the patients get used to, and they increase and decrease their dose very effectively with time. It's just trying to get used to it. They come in many shapes and names like pancreasyme, crayon, etc. However, they're very, very effective. If you require any further information, then please write in the comments below and I'll be happy to answer your questions. I hope you found this video informative. And if you did, then please remember to subscribe and give us a thumbs up. Thanks for watching.